Nicola, if it's not a magic bullet, why should we be taking vitamin D supplements? How would it protect against the coronavirus?
Well, it's like you just said, Rachel. It's known as the sunshine vitamin, vitamin D, because that's how we absorb most of it. A little bit we get from food, oily fish, eggs, mushrooms, but not enough. And it has long been known that it does have an effect on the body. Now, the main thing that people take it for in the winter, and it is actually advised in the UK, certainly to take it in the winter, is to lift the mood, to counterbalance depression, to strengthen the bones. And because there has been evidence showing that it can be effective against acute respiratory infections. And it's because of that that so much research has been going on in the last few weeks to see what impact it might have on COVID-19. And as you said, Rachel, they're not showing that it prevents it, but they are showing that if you're deficient in it, it's not good for you. So much so that a study in the Irish Medical Journal, the author of a study there, Professor Rose Kenny, said that she feels everybody should definitely be taking vitamin D because it's shown the effect it can have on preventing respiratory infections. And a professor from Nottingham University, also in the UK, Professor Neil, as well, he's a professor of epidemiology of respiratory diseases, and he actually says that he advocates taking vitamin D supplements because of this thought, this scientific evidence that's building that a deficiency in it can have an impact on your susceptibility to COVID-19. Now, the study that you're referring to there, the one in the BMJ's Nutrition Journal, has looked at all of this evidence together, and it says it's not a magic bullet. It's not saying go out and take high doses of vitamin D, but it is saying it's advisable to take the dose that each country's government recommends. That might be 400 international units, that's how they measure it here in the UK, 600 in the rest of Europe, and if you're older, 800 of these international units.
Okay, that is important to know. Do scientists think that it has any other role in COVID-19?
They do actually, yes, and some studies have been collected and collated by Northwestern University in America, and what they've identified is that people who have severe vitamin D deficiency have a much worse outcome if they end up with severe COVID-19. And they've said that, in fact, it's quite an impactful amount, because the other thing that vitamin D does is working on the pathways in the immune system. It actually can prevent these cytokine storms that we've all been hearing about. And of course, we've known that people who've ended up in hospital with a cytokine storm, which is when the body's immune system goes into overdrive, they have a much poorer outcome. And Dr. Vadim Bachman, who is the lead author of this study from Northwestern University, he says that his analysis is that it might be as high, and I'm quoting him here, it might be as high as cutting the mortality rate in half if people were not deficient in vitamin D, which is a pretty strong thing to say.
Yeah, intriguing indeed. Thank you so much, Nicola Hill, joining us from London.